Peyronie's disease. It's a condition that can cause significant concern for men, impacting not just their physical health, but also their emotional well-being and intimate relationships. In this video, we'll explore everything you need to know about Peyronie's disease, from its potential causes and symptoms to the latest treatments and research. The exact cause of Peyronie's disease remains somewhat of a mystery, but experts believe it's primarily linked to trauma or injury to the penis. This injury, which may be subtle or even go unnoticed, can lead to abnormal scar tissue formation beneath the skin. Genetic predisposition may also play a role, making some men more susceptible than others. While the specific triggers can vary, the end result is the development of the characteristic plaque that defines Peyronie's disease. At the heart of Peyronie's disease lies the abnormal healing process following penile injury. This process leads to the formation of a dense, inelastic plaque, typically composed of collagen, under the tunica albuginea, the fibrous sheath surrounding the erectile bodies. This plaque restricts the elasticity of the affected area, causing the penis to bend or curve during erection. In some cases, the plaque can also calcify, becoming hard and palpable. Peyronie's disease is estimated to affect between 0.5% and 13% of men, with prevalence increasing with age. It most commonly appears in men between the ages of 40 and 70, but it can occur in younger men as well. While not always reported, researchers have noted that patients with diabetes and those taking beta blockers may have increased risk for Peyronie's disease. The signs and symptoms of Peyronie's disease can vary from mild to severe. The most common symptom is the presence of a firm lump or plaque that can be felt under the skin of the penis. This plaque often leads to curvature or bending of the penis during erection, which can range from subtle to severe. Pain during erection or even in a flaccid state is also possible. In some cases, Peyronie's disease can also contribute to erectile dysfunction or difficulty achieving and maintaining an erection. Psychological distress, anxiety, and difficulties with sexual intercourse are often experienced because of these symptoms. Diagnosing Peyronie's disease typically involves a physical examination by a doctor. The doctor will palpate the penis to identify and assess the plaque. A patient history will be taken depth to discover the duration, severity, and impact of symptoms. Sometimes, an ultrasound may be used to visualize the plaque and assess blood flow to the penis, and may also include a stimulated erection with the use of an intracavernosal injection to accurately assess the penile curvature. While not strictly classified into distinct types, Peyronie's disease is often described in terms of its stage: active or chronic. The active phase is characterized by inflammation, pain, and worsening curvature. The chronic phase occurs when the curvature stabilizes and pain typically subsides. There's also variation in the location and size of the plaque, which can affect the type of curvature that develops. Treatment for Peyronie's disease aims to reduce pain, improve penile curvature, and restore sexual function. Treatment approaches vary based on the stage and severity of the disease. In the early active phase, oral medications, such as vitamin E, or topical creams might be used to address inflammation. Injection therapy using collagenase Clostridium histolyticum is another non-surgical approach to dissolve the plaque. Surgical options, such as plaque excision, grafting, or penile prosthesis implantation, may be considered for severe curvature or erectile dysfunction. A vacuum erection device and penile traction therapy may be implemented at home as well. There's no definitive way to prevent Peyronie's disease, but minimizing trauma to the penis may help. Using caution during sexual activity and avoiding forceful bending or injury can be prudent. Maintaining good overall health, including managing diabetes and cardiovascular risk factors, may also contribute to reducing the risk. The prognosis for Peyronie's disease is variable. In some men, the condition stabilizes on its own without treatment. However, in many cases, the curvature remains stable or even worsens over time. Treatment can often improve curvature and sexual function, but results vary depending on the individual and the severity of the disease. Recent research has focused on developing more effective non-surgical treatments and refining surgical techniques to improve outcomes and minimize complications.